Hello, everyone. Today we're going to be talking about assessing symptoms in the general geriatric patient. We will look at the challenges this population presents, as well as steps to take to ensure the assessment leads to appropriate care for the patient. The objectives for this session are to identify how to assess non-pain and pain symptoms in an older patient, explain how to collaborate with interprofessional team members, including those from nursing, pharmacy, and palliative care, and finally, we will discuss how to reduce suffering through non-pharmacologic and pharmacologic treatments based on the patient's goals of care and safe prescribing principles. Providers can encounter many challenges when assessing symptoms in older adults. It can be difficult to gather a complete medical history, and as a result, this population requires a comprehensive and nuanced approach to care. Some of the challenges encountered are atypical symptom presentation. Older adults often exhibit symptoms differently than younger patients, making it difficult to recognize common conditions like infections or heart attacks. Multimorbidity. Many older adults have multiple chronic diseases simultaneously, which can complicate symptom attribution and treatment planning. Communication difficulties such as hearing loss, vision problems, and cognitive impairment can hinder accurate reporting of symptoms and medical history. Functional decline. Changes in daily activities due to physical limitations can be mistaken for disease symptoms, requiring careful assessment of functional status. Polypharmacy. Taking multiple medications can cause side effects that mimic other medical conditions, and thus more challenging to make an accurate diagnosis. Dementia or mild cognitive impairment can affect a patient's ability to accurately report symptoms, requiring reliance on caregivers for information. Ageism or unconscious biases can lead to dismissing symptoms or assuming decline is solely due to age, rather than underlying medical conditions. Social isolation, lack of support systems, and living situations can impact health and complicate assessment. Many age-related changes, for example fatigue and pain, can overlap with symptoms of disease, making diagnosis difficult. Some physicians may not have adequate training in geriatric assessment, leading to missed opportunities for early detection and appropriate management. These complex issues make it crucial to conduct comprehensive geriatric assessments that accurately diagnose and manage the health issues older adults are encountering. Assessing pain in older adults can be complex. Providers should utilize a comprehensive approach to get a full picture of what the patient is experiencing. The following are key aspects of pain assessment in older patients. A detailed review of the patient's medical history, including chronic conditions and medications, to help identify potential sources of pain and any drug interactions. Tools to assess pain include self-reported pain scales such as the verbal descriptor scale that uses words like mild, moderate, severe to describe pain intensity. The numerical rating scale asks patients to rate pain on a scale from 0 to 10. The visual analog scale uses a line that patients mark the point that best represents their pain level, and the Wong-Baker face scale is picture-based and allows the patient to point to the face that most portrays how they feel. Observational cues are an important part of assessing pain. The provider should focus on the following: facial expressions such as grimacing, wincing, or frowning, body language including guarding, bracing, or altered posture, vocalization such as moaning, groaning, and sighing. In addition, changes in behavior should be assessed. Has the individual been more withdrawn, agitated, or restless? Another helpful evaluation is the functional impact assessment. Ask about how pain affects daily activities like dressing, bathing, eating, walking, and sleeping. You should consider the patient's ability to participate in social activities and hobbies. A cognitive assessment such as the Mini-Cog or Montreal Cognitive Assessment should be performed to evaluate if a patient can reliably report pain. For patients with severe cognitive impairment, where verbal communication is limited, the scale for pain assessment in advanced dementia can be utilized. Pain assessments should be conducted regularly to track changes over time and adjust treatment plans accordingly. Involve caregivers as part of the assessment and inquire about changes in the patient's behavior that may indicate pain, even if the patient cannot self-report. It is essential to ask about the patient's perception of pain and whether they believe it is a normal part of aging, while also involving caregivers for additional insights when necessary. Allow patients to describe their pain using their own words. Give patients time to respond and avoid rushing through the assessment. Use simple language and consider visual aids if necessary. When assessing non-pain symptoms in an older patient, providers should conduct a thorough medical history, while also performing a physical examination and utilizing specific assessment tools depending on the suspected symptoms. Incorporate caregiver input to gain a complete picture. A detailed medical history should include an assessment of the patient's functional status, focusing on their ability to perform activities of daily living such as bathing, dressing, eating, and toileting. It should also screen for mood and mental health concerns like depression or anxiety using validated tools. Sleep patterns, including quality, disturbances, and daytime sleepiness, should be reviewed, along with appetite and nutrition, noting any changes in intake or weight. Additionally, bowel and bladder function should be assessed for issues like constipation or incontinence. Evaluating fatigue and its impact on daily life is important, as is understanding social and environmental factors such as the patient's living situation, support system, and any sources of stress. Physical examination assesses the individual's general appearance. Observe for signs of weight loss, dehydration, or poor hygiene. Monitor blood pressure, heart rate, and respiratory rate. A neurological assessment includes assessment for cognitive impairment, memory issues, and changes in mental status. Finally, the physical exam should include a systemic review and relevant exams based on reported symptoms, such as cardiac, pulmonary, or musculoskeletal assessments. Some specific assessment tools that can be used during the assessment include Geriatric Depression Scale, a screening tool for depression in older adults. Mini Mental State Examination, a cognitive assessment to evaluate for cognitive impairment. Edmonton Symptom Assessment System, a comprehensive tool to assess various symptoms including pain, fatigue, nausea, and shortness of breath. Pain Assessment and Advanced Dementia Scale is used to assess pain in patients with severe cognitive impairment. 4M's Assessment, What Matters, Medication, Mobility, Mentation, used to improve care for older adults by integrating these elements into healthcare practices. Nutritional assessment tools may be used to evaluate dietary intake and potential malnutrition. Providers can collaborate with nurses, pharmacists, social workers, dietitians, chaplains, and palliative care specialists by actively sharing information about an older patient's symptoms and leveraging each team member's expertise to create a comprehensive care approach. Regular communication plays a central role, with nurses offering detailed observations of patient behavior and symptoms, pharmacists identifying drug interactions and optimizing medications, and social workers assessing the social and emotional factors influencing health. Dietitians address dietary needs, chaplains provide emotional and spiritual support, and palliative care specialists contribute to symptom management and end-of-life discussions. Shared decision-making is essential, encouraging providers to exchange insights on diagnoses and treatment plans while incorporating the unique perspectives of each discipline. Nurses' understanding of functional status and pharmacists' input on medication adjustments enhance this process. A holistic assessment considers both physical symptoms and psychosocial needs, supported by ongoing evaluations of pain, fatigue, appetite, mood, and functional ability. Above all, patient-centered care remains the priority. Team members must include patients and families in decision-making to ensure that care aligns with their goals, values, and preferences. Open communication with the patient is key to understanding their concerns and addressing symptoms effectively. Some beneficial collaboration strategies include holding regular interdisciplinary meetings where physicians and other healthcare professionals can come together to discuss patient cases, share insights, and develop coordinated care plans. These meetings ensure that all team members are aligned and can contribute their expertise effectively. Utilizing shared electronic health records, or EHRs, is another key strategy, as it allows all members of the care team to access current patient information, monitor symptom progression, and document interventions, facilitating seamless communication and reducing the risk of errors. Applying collaborative care models, such as a medication optimization clinic for heart failure patients, enhances outcomes by bringing pharmacists and nurses together to manage symptoms and optimize medications. Increasing the use of telehealth and mobile applications further supports collaborative care, especially for palliative patients, by enabling remote symptom monitoring and timely interventions. Each discipline plays a unique role in this team-based approach. Nurses monitor daily symptoms, provide direct care, and educate patients and families. Pharmacists manage medication regimens and advise on symptom control, and palliative care specialists address complex symptoms, offer emotional support, and coordinate care. By fostering open communication, embracing technology, and leveraging each team member's expertise, providers can deliver holistic, effective care tailored to the needs of older adults. Older patients often experience different levels of suffering, which can make their later years increasingly difficult. To help ease this burden, a variety of non-pharmacologic strategies can be used to improve comfort and quality of life. Supporting physical comfort is essential and can include regular repositioning to prevent pressure sores, gentle massage therapy to reduce muscle tension, the use of heat or cold packs for pain relief, and personalized exercise routines to maintain mobility. Sensory stimulation also plays a key role. Calming music, creative art activities, and aromatherapy with essential oils can help lift mood and reduce anxiety. Cognitive and social engagement is equally important. Therapies like reminiscing about past experiences, life review sessions, group activities, and pet therapy can foster connection and emotional well-being. Psychological support should not be overlooked. Techniques like deep breathing, meditation, progressive muscle relaxation, and cognitive behavioral therapy can help manage stress and negative thoughts, while spiritual support can offer additional comfort through connection with faith or spiritual practices. It is crucial to tailor all interventions to each patient's unique needs and preferences to provide the most meaningful and effective care. If non-pharmacologic strategies are not successful in decreasing suffering for the patient, the next course to consider is pharmacologic treatments. Here are some things to keep in mind when using pharmacologic treatment. Accurate pain assessment is necessary, utilizing validated pain scales adapted for cognitively impaired patients to accurately identify pain levels and guide treatment decisions. Follow a stepped care approach by starting with non-opioid pain medications like acetaminophen or NSAIDs, such as ibuprofen, before progressing to opioids for moderate to severe pain. For neuropathic pain, consider medications like tricyclic antidepressants or anticonvulsants for nerve pain. Pain will likely be in better control with a multimodal approach. When initiating medications, consider lower starting doses and a gradual titration based on individual needs and response. Regularly assess the effectiveness of medications, monitor for side effects, and be aware of potential drug interactions due to polypharmacy. Collaborate with other multidisciplinary healthcare professionals such as physical therapists, occupational therapists, and social workers to address the patient's overall well-being. Here are some key points to keep in mind when assessing symptoms in geriatric patients. Geriatric patients are often challenging to assess due to issues that include atypical symptoms, cognitive impairment, functional decline, polypharmacy, and communication difficulties. A comprehensive assessment of pain is necessary to understand the full scope of what the patient is experiencing. It's important to evaluate both pain and non-pain symptoms. Using an interdisciplinary, collaborative approach to symptom assessment in geriatric patients effectively applies the strengths of each team member to provide a comprehensive assessment. Suffering can be reduced in geriatric patients by using both non-pharmacologic and pharmacologic interventions. Focus on incorporating non-pharmacologic strategies first and then move to pharmacologic measures. Proper communication with patients and their families about pain management strategies ensure understanding and shared decision-making and ultimately the best care. Here are our references. Thank you for listening to this presentation.